right, Caitlin. Today we're going to learn how to package a liver for transplant. I'm going to start off with this little video.
Heads up, transplant coming through. Move, people, move. Wow. Budweiser.
I wonder where the other cooler is.
The beer is here.
That is one of my favorite Super Bowl commercials of all time. But today, so we're going to learn how to package a liver for transplant. What do you think would happen in real life if the organ arrived to the hospital and you couldn't identify what it was in?
That recipient probably wouldn't get that organ.
That's right. It's unlikely that it's going to go to a beer party, but it is possible that more than one organ will show up to the OR at a busy transplant center at the same time. So they have to be appropriately packaged to maintain sterility, because we don't want the recipients getting sick or to die from an infection. And we also must properly label them. So today we're going to focus on just the liver. All of the large organs, lungs, intestines, and liver will be packaged in basins, in a basin in bags. Smaller organs will actually go in these hard containers, but it's actually the same method if you think about it. We're going to start off, so in these small ones we can do heart, pancreases, and left and right kidneys. We're not going to focus on that today. I just want to give you background on this container, because UNOS policy requires a triple sterile barrier. So repeat after me: bag, bag, slush, bag.
Bag, bag, slush, bag.
Bag, bag, slush, bag.
Bag, bag, slush, bag.
One more time: bag, bag, slush, bag.
Bag, bag, slush, bag.
That's right. These are the bags that I'm talking about, isolation bags.
Okay.
So we would do bag, bag, slush, bag.
Okay.
In the instance that we were doing a smaller organ that will fit in here, UNOS policy says that if you're using a hard container as an interior container, it can count as one of your bags.
Okay.
So it would still be bag, bag, slush, bag, except this would be your bag.
Okay.
So you could do bag, bag, slush, bag on top of that, like that. Now I'm going to invite you up here to practice. We're going to practice this.
Okay.
I do want to show you this one thing that we use are these color-coded organ labels and associated tags. So you can see here the liver is green, the heart would be red, the lungs, if we're packing them in block, purple and orange, pancreas is peach, intestines pink, the right kidney is blue, and the left kidney is yellow. So everything is color-coded when it gets to the hospital,
Okay.
so people will be able to tell what's going on. So here we go. We're going to have bag, right? Here you go. We'll let you do yours at the same time. I usually use a basin to squish the air out of it.
Okay.
What comes next?
Another bag.
Another bag.
There you
You have one too? Yep.
go. Slush.
Slush. Now in this demonstration we're using these little cards with frozen, but
Okay.
basically it would be a frozen bag of normal saline, like
Okay.
this. And then what else?
Slush bag.
Yep, so bag, bag, slush,
There you go.
bag. In real life, we would be scrubbed in the operating room too, not wearing our street clothes and on table in the break room. Okay, let's push that out.
Okay.
Now inside of this, you would put preservation solution. And in this particular case, we're going to be using these cutouts of preservation solution.
Okay.
So I'm going to give you, here, I'll give you some. I'll take this back so that you can
Okay.
put your own solution in there.
So solution.
Solution goes in.
Okay.
And then our organ, whichever one. You're going to be doing the liver, so here's your nice liver.
Okay.
Yeah.
I
Liver.
have to put it right here.
Yeah, put your organ,
Okay.
and I'm gonna just do the lungs, but I'm not gonna package the lungs
Okay.
onto that, I'm just gonna show you. So now we're gonna tie up this first bag.
Okay. Do you need to get the air out of it, or is it okay just to?
Yeah, we usually will clear the air out. Today, we don't have to do that
Okay.
because we want it kind of puffy when we put it in the box, so you can get an idea, but you would normally clear the air out
Okay.
of, the container by, you would twist it up like this
Okay.
and squish the air out. I don't wanna squish it out today because
Okay.
we're trying to, have a little volume since we've got cutouts. Yeah. So bag,
Slush bag.
slush bag. Now look at this. I have an organ
Mm-hmm.
and you have an organ. Which one's which? It's hard
That's
to
why
tell.
you need a label.
That's why you need a label, exactly. So that's the reason why we put these
Okay.
laundry tags on them. You will tie
Okay.
that to the outside because we don't want to put the lungs in the liver box.
Okay. Alrighty, this is all tied up.
That's tied up. So inside of our box, we're going to put a tissue type of material, and also because they're going to have to cross match the patient when it gets to the hospital and do an ABO confirmation.
Okay.
So inside of this bag that's labeled with nodes and spleen and blood,
Mhm.
you want to put in this bag 2 yellow top tubes,
Okay.
1 red top tube, and then these samples, which will be bathed in this RPMI solution in real life, but we just have cutouts of it today. You would do a spleen
Okay.
and lymph nodes,
Okay.
3 to 5 lymph nodes, 1 3 to 5 centimeter wedge of spleen.
Okay.
So inside of our liver box, you would first put your liver.
Okay. I know that's
Mhm.
my liver box.
And then there's going to be wet ice in there, and we would top it off with wet ice, so
Okay.
it would be totally encased in ice. And then we're going to tie up this inside bag.
Okay.
And these are the strings that we actually cut right out of the isolation bag, so
Okay.
you will have those on hand in the operating room. And because red blood cells, potassium inside the red blood cells form crystals if they're frozen, you don't stick this in the ice, you stick this on top of the ice,
Okay.
just
Just to
like
keep
that.
it cool.
That's right, keep it
Okay.
cool. Put your lid on,
Okay.
and then tie up that last bag. And before anybody ever gets into this organ, into this cooler box, we want them to be able to open the box up. They'll see from the outside label that it's a liver.
Okay.
But we want them to be able to look at the donor information to see if it's the right blood type and if there's any infectious disease. So that's what's in our donor packet.
Okay.
And so we put that right on the top
Okay.
so that when they open up that box, that's the first thing that they will see.
That makes sense.
That's
Okay.
right. And so then you just close up your box. Oop, the other flap goes first because this will actually stick right into that little groove.
Okay.
Great. And then now we've got our label with our UNOS number and our blood type and the contents. That's got the liver, the documentation, the blood, and the nodes
Okay. Very good.
inside that box. And that's how you package a liver for transplant. That's actually how you package every organ for transplant.
Okay.
Exactly that method, with the exception of if you were to have a smaller one that will fit inside this jar, you can use this jar as one of your labors. But if you always remember,
Bag. Slush bag.
you'll remember how to do every single organ for transplant.
Okay.
All right, any questions about that?
I don't think so. I don't have any questions.
Okay, so why don't you just practice you can take these materials and practice overnight if you want,
Okay,
and we'll
great.
come back tomorrow, and I want you to be able to package that without any direction from me.
Okay.
Great.
Awesome. Thank you.
Thanks.